Welcome, everyone. We'll get started in just a moment. As you're joining, please feel free to add your name, title, or role, your organization, and the city state you come from as you're joining. Welcome. We'll go ahead and get started. Again, if you're just joining, please chat your name, your title or role, your organization, and your city and state as you join. We'll go ahead and kick this off. We're so excited to welcome you to this presentation on our exciting new RFP to address food insecurity in SBHCs. As a reminder, we're recording this session. We'll keep you muted while we're speaking, but we expect this to be a pretty informal presentation. We would love to hear your questions. You're welcome to enter them in the chat or the Q&A box down at the bottom, and just be sure to send them to all panelists so that we receive them. Here's our agenda for today. We want to give you a little background on our organizations, the overview of the RFP and how it came to be. We'll share our toolkit that we've developed in our work thus far, and we'll go over any frequently asked questions that have popped up and then open it to Q&A. So my name is Katie Stinchfield. I'm the Director of Behavioral Health Programs at the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based healthcare, because we believe that when health and education come together, great things happen. I'm so excited to pass to my colleague, Sarah Mills from No Kid Hungry.
Hi, everyone. Thank you so much for being here. We're really excited about all the interest in this opportunity. My name is Sarah Mills. I'm a program manager at Share Our Strength. Share Our Strength is an organization dedicated to ending hunger and poverty. And we work through proven effective campaigns like the No Kid Hungry campaign, connecting people who care with ideas that work. So, you know, we're really interested in ensuring that all kids have access to the healthy food that they need to thrive. And much of our work in the past has really focused on the schools and ensuring kids have access to healthy food through school meals and other school programs. But we also know that families are regularly interacting with healthcare, and we believe that healthcare providers really play a critical role in identifying and connecting families to resources like healthy foods that can really have a great impact on health outcomes. Next slide, here. So that's why, you know, we've been so excited to partner with the School-Based Health Alliance. You know, together, we want to work together and support school-based health centers to address food insecurity. And we know that food insecurity can have such an impact on the health and well-being of youth and families. And so, you know, like it is saying here, you know, we believe that by working together to embrace and build on families' trust in school-based health centers, we can promote federal nutrition programs and nutritious food consumption and support positive health outcomes and improve food security for youth and families. So I think, you know, before we really jump into the current RFP opportunity and going through some of those FAQs, we thought it was really important to kind of talk about the context for this opportunity and sort of what we've been doing over the past year, which has led us to this place. We had released an RFP in December of 2021, a joint, again, RFP from School-Based Health Alliance and No Kid Hungry, that was for individual school-based health centers that wanted to participate in a learning network and grant opportunity to address food insecurity. So the result was that 16 school-based health centers across 12 different states, and kind of representing a pretty broad array of communities, rural, urban, suburban, and different sizes of school-based health centers, really came together to identify strategies and implement those strategies to address food security for the youth that they were serving, and their families and communities. And so with this original learning network, we had hoped to accomplish a few different things. So our goals were to either create a model or expand on a model that the health center was already using to identify food insecure students and connect them to healthy food resources and nutrition education. We also plan to evaluate that model and understand how it was impacting student and family food insecurity, how it was impacting fruit and vegetable consumption, and how it impacted health outcomes, and particularly the engagement of those students with care at the center. And then we also hope to develop some promising practices that could be replicated in other school-based health centers, and offer some resources for other centers who wanted to get involved in this work. And so our network met together monthly over the last year, throughout 2022, and just learned from each other on the best ways that school-based health centers could really address food security for students. So the centers brainstormed together, shared ideas, discussed challenges, solutions. And ultimately, all of our school-based health centers were really able to identify a variety of methods for connecting families to resources, or developing new resources to help bridge gaps that they identified. So in our first year of that grant project and learning network, we had some really exciting outcomes. You can see in the kind of grid on the bottom that there was really a variety of interventions that the different school-based health centers employed to address food insecurity for families. So many of them were doing some sort of food insecurity screening. And so through this process, they were able to expand or start doing that screening process. And then making referrals to food programs. And so that seemed to be one of the lowest barriers to entry for a lot of our school-based health centers in starting to address food security. And then beyond that, there were many other ways that the centers were connecting families with food resources, whether that be emergency resources on site, like a pantry or food bag, providing gift cards, meals, nutrition education, farmers markets on site, produce vouchers. There was just such a variety of methods that the school-based health centers were engaged with, either directly or through partnerships in their community. And we definitely identified that data collection was a challenge in our first year, but the centers that were able to collect some data on outcomes, we saw some really incredible numbers, including over 5,000 youth and their families were reached in some way through these different interventions. And many households screened for food insecurity, referred to federal food programs or other food resources. We're seeing improved reports of food security and improved dietary health. And beyond some of the quantitative results, the school-based health centers were also seeing some other really important progress in terms of systems change or just culture change at their school-based health center. So a lot of the the centers in our original cohort noted how important this project was in just elevating the needs in their community to leadership at the school or in their health system, providing training or increasing the awareness of their staff of different resources, and really building connections in the community with other organizations that they wouldn't necessarily typically be partnering with. A lot of the centers also were identifying that they were building closer relationships with the families that they served, and more broadly able to get their services known out in the community. So by offering some of the food programming, it brought in new students to engage with their health services. So a lot of really amazing and positive results. And I think I'm going to turn it over to Katie at this point, who's going to talk a little bit more about some of the other exploration work that we had done last year.
Yeah, thanks, Sarah. So we built off the work that Sarah was just sharing, and we realized we wanted to gather some more information before we built out this new opportunity. And so we did a variety of things. We got input from our grantees and our learning network that Sarah just shared, and reached out to people working at the state level, our affiliates, a range of other participants, and also youth stakeholders, so that we could learn more about what people really broadly thought would be effective in terms of addressing food insecurity in SVHCs. And we learned some fabulous things from that work. If you're interested, you're welcome to read the full report. No pressure, not an RFP requirement, but certainly something you can access in our toolkit. Basically, this report told us that the items in the box were what felt really important: the need for a state level, more state level support and kind of structure, having dedicated staffing for the project, policy and advocacy as always, reducing stigma, having realistic timelines, and a more localized approach, again with that state level structure. And so that led us to develop our new request for proposals that we're discussing today. And in the meantime, while we were doing all this, we did put together our toolkit. So I wanted to share briefly about that on the next slide, and also share this link. So if you're interested in the resources we've put together to date, those are here, the link I just put in the chat. We're pretty proud of everything that we learned with our prior learning network, and looking forward to adding to this toolkit as we move forward. And with that, I'll let Sarah share about the new opportunity you're all here to hear about.
Yeah, so with that kind of background and resource, the toolkit resource in mind, we're going to move into talking about the new RFP opportunity. We, like Katie said, we're really, we really believe that this is a very exciting next step for learning and continuing to identify ways that we can replicate and scale, successful interventions to address food insecurity for, students and families. So I think the plan is just to kind of walk through the RFP sections. We'll kind of highlight a couple of the key points from each section, but as we go along, feel free to include your questions in the Q&A, and we will do our best to answer as we go through.
Thanks, Sarah. So again, we're looking for a state level applicant. So some of those applicants might be our School-Based Health Alliance state affiliates through SBHA, might be a state coordinating body for school-based health centers. Not every state has all of these things, and we understand that. So it could also be a state level health organization that is supporting or assisting in school-based health center oversight and management, or a regional tribal health organization that oversees school-based health centers. We want the projects to work closely with at least 10 school-based health centers in their state, so a strong network of 10 or more. And certainly the state entity will have to have grant-making capabilities to pass grants to their participating SBHCs. Next slide. So the big picture goals, obviously, are to integrate food access into school-based health center services and workflows. And there's a variety of ways that we look at doing that: food security screening, referrals to nutrition programs that already exist, enrollment assistance, warm handoff to other community food programs. Obviously, that looks different on the ground depending on where you're at, and you'll have to connect to those local resources, and establishment of food assistance on site. So it might be a pantry, might be a produce prescription, could be a number of things. And we hope that you'll, again, we've got this fabulous toolkit we want to keep working on. So we really want to identify and share best practices throughout the learning network within your state, but also collect those for the future to, again, continue building out impact on this. This is obviously kind of open, and we want to be clear about that we're looking for creative solutions. So if you have ways to do this in a creative way, please share that. We look forward to hearing from you. Sarah, I think.
Yes, that's me. Sorry, just getting myself off mute. So kind of going into a few of the project components that were listed in the RFP, and breaking that down a little bit into what immediately we would be expecting the grantee to work on, and what kind of things are expected throughout the course of the grant. So once the organization is awarded, the first step would be really to identify a lead staff person or persons, and develop an evaluation plan. So that lead staff person would work closely with our No Kid Hungry and School-Based Health Alliance team, initially to identify how we want to go about doing the evaluation. We'll talk about that a little bit in more detail in a couple of slides. And then identify the method for doing the subawards to the school-based health centers. So we'll need, a staff person to be leading that process. And then ongoing, providing some technical assistance and collaborative learning opportunities for the school-based health centers that are subawardees. So, similar to how we brought the cohort last year together for opportunities to share, what they were learning, what was working, what wasn't working. We are hoping that this lead grantee would provide those same opportunities to school-based health centers in their state that they're working with on this project. The lead grantee would also be supporting the data collection according to the evaluation plan that we put together, would also be supporting any opportunities for youth and community engagement in the projects. So engaging the community voice in, how the school-based health centers are incorporating food security in their center services, and then also participating in their own learning network calls. In the next slide, we'll talk a little bit about these different learning networks. And then finally, really be thinking about and identifying opportunities for, how this could be sustainable or replicated in other school-based health centers in your state or region. So throughout this process, documenting those, lessons learned and, opportunities for continuing to scale this to other school-based health centers. So there are a couple of different learning networks that we reference in the RFP. So we wanted to be clear about what the difference was between those two networks. So the first network is led by School-Based Health Alliance and No Kid Hungry. And so that learning network would be for these state grantees that are awarded through this RFP, along with our original learning network of school-based health centers. So the 16 school-based health centers that we worked with last year, many of them are continuing on this year, participating in a quarterly learning network meetings. And so the awardees from this RFP opportunity would be folded into that learning network and be involved in those quarterly meetings. And then the second learning network would actually be led by this grantee, and that would be for the school-based health centers in your state that are subawarded through this grant. And so the No Kid Hungry School-Based Health Alliance team would provide some technical assistance for you all, but it would really be up to you in how you want that to look for your state. And how, what types of support that you want to be providing depending on the needs of the school-based health centers that you're working with.
Thanks, Sarah. So again, we want to evaluate our work. We want to collect data on what we're doing and show our impacts. And so in terms of the current opportunity we're discussing today, that state level request for proposals, these are kind of some of the broad things we will look at evaluating as part of this process. There are more details in the actual request for proposals document, as well as the selected sites we'll work with very closely to ensure that we can do these different pieces of the evaluation process, reach some of these outputs and outcomes, and potentially look at some of the other metrics of interest that we're hoping to investigate or achieve. Next slide. So these are some kind of key things we wanted to call out in the RFP, that your evaluation plans, again, will be developed collaboratively with the School-Based Health Alliance and No Kid Hungry. We'll support you in this. We have a quality research and evaluation team that's working on this. And so do not feel like, don't feel daunted by this requirement, because this is something we'll help you with. Same thing, we'll be providing technical assistance and support in determining methods and data collection tools. And you will be responsible for supporting your sub-awarded SVHCs to collect data that we'll outline in the evaluation plan. But again, we'll be there to support you in figuring all of that out and how to do it successfully.
So the grant budget there's no set budget template that we're requiring with this RFP. So any format that you want to submit is fine. And I also want to mention that budgets, we can adjust them after the award announcement, based on, the evaluation plan or other questions that come up in the process. But generally, the budget amount is, total budget amount is $350,000. And we're thinking that amount would be generally divided between two main categories. So one would be subawards to the school-based health centers that you're working with. And so those subawards would be provided to the school-based health centers to support them in integrating those food security interventions. So that could be their staff time, that could be technology, that could be food, that could be a number of different things that would help that school-based health center to be able to integrate food security solutions with their school-based health center service. And then the other portion of the budget would really be allocated to the lead grantee for their staff time and their organizational resources that would be dedicated to managing this project and supporting the school-based health centers. We put some approximate amounts for that breakdown. It doesn't have to be exactly this, but we wanted to provide a little bit of guidance on how we were thinking that the budget would be allocated. And then one question that did come up was about if a lead organization could subcontract with another agency to provide kind of those technical assistance services. And I think that is definitely an allowable expense with this award. I think the one thing we would want to understand in your proposal or in your budget narrative would be about kind of what the breakdown of responsibilities would be between like the lead organization and the organization that's providing the technical assistance services. So, for example, the lead organization is going to be responsible for like the data collection and the sub-awarding process, while the TA contracted agency is really just going to be leading the learning network for the school-based health centers. So just having a little bit of an idea of, what exactly the subcontractor would be providing.
Thanks, Sarah. So this is a piece that I really want folks to pay attention to. When you go to apply, there are a couple of things you really need to notice here. We have both a document to complete and upload and an online form. And the online form does not save your progress. So what we recommend is that you download the application form, the Learning Network RFP. So you see in red, 2-part application. So the first thing, download that document, complete that and save it, then upload it to your application. When you go to complete the form, the online form is a shorter application. When you go to complete the online form, have that other document ready and upload it at the end all at once. I also, were it me, I would look through this form, I would open the online form, type my responses into Word, and then have them all ready to go, then cut and paste them at the end. Unfortunately, I'm sure I'm not the only one who's been there when the form loses my responses and I get to do it all over. So we apologize that the form doesn't save your responses, but we're hoping that you can try these little workarounds to get everything in there correctly. And Harper, if I missed anything, feel free to jump in. Harper has done an amazing job putting this all together so that we can cover all our bases.
Thanks, Katie. I just want to add that the online form, the questions that are there are truly just like, what's your name? Tell us about your organization you come from. They're quick and easy questions to answer. And that form that you upload and we'll do a forced copy of, those are going to be more of the long answer questions that you may have to go find those somewhere and then come back and upload those. So that's why we've kind of split it into these 2 parts. So funny enough as it is, this is the easy way to do it.
Yeah, thanks, Harper. Yes, and the good point. So it will force you to make a copy when you're working on it. So that also helps. You can tell we're wanting to avoid people having to deal with this. So this form, and then I think the next slide, Harper, shows the. Yep. So this is what you will complete. That will do the forced copy, I believe. And once we get that all in, we'll review internally. If you have any questions about that, you're welcome to reach out to us at any time if there's any kind of issue or question.
So the last thing we wanted to review is just the timeline. So we're doing the webinar right now. You have about a month before the submission deadline. So we realize that as you start working on this or looking at the RFP in more detail, additional questions might come up. So please feel free to reach out to us as you're working through the application. And then we're expecting to review all of the proposals in May. It's possible that we may reach out for some additional information or to schedule a follow-up call before making our final decisions, but then the award announcements would be no later than June 1st. And then we expect the start of the grant to be July 1st, anticipating that in June, there'll be some finalization of grant budgets and things like the whole contracting process. So might be some additional, information or pre-work needed in the month of June as we get those contracts finalized, and then hit the ground running, hopefully July 1st. And then the anticipated end of the grant would be September 30th, with hopefully giving time for a full, school year of working with your school-based health centers on this, and then sometime, next summer of 2024 to sort of consolidate all of all the learnings and any data collection that's still needed.
So Sarah, I received a question in the chat shout out to Sherry for identifying what I think will potentially be a common question, because we did this initial learning network of 13 school-based health centers around the country. They, of course, are located in states, and those states may now be looking at applying for this opportunity. So Sherry, we can get back to you specifically on your Louisiana question, but I do think that this will come up broadly for us. And I know, Sarah, we discussed this earlier, how we want to approach that.
Yeah, I'd say, yeah, certainly states where the school-based health centers in the original cohort were located are welcome to apply for this opportunity. This opportunity is really about scaling what we've learned and working with, you know, a state level organization that can provide some more like localized support to school-based health centers in their state, but then also, you know, work with those school-based health centers to replicate across and identify those challenges and help support the solutions. So yes, I would say certainly those organizations are welcome to apply.
Thank you for answering. I asked because we have two different organizations that are providing our school system with school-based health clinic services. And I just want to make sure that one organization is not already plugged in. I suspect after hearing your presentation that they may have been one of the original 16 participants, and that would take away from us being able to participate in this.
I don't, Katie, can you?
Harper was going to look it up once we're not in presentation.
Yeah, that's fine. Thank you.
Yeah, I do. I'm blanking off the top of my head, but yeah, so individual cases like this, Sherry, we could definitely look it up and sort of see where we've been working, what the overlaps are, and we want to, you know, again, as Sarah said, the goal is to just get this out there more, and so we want to work with the sites, you know, potentially that we're already working with, if that makes sense and leads to more scaling and greater impact. So open to a variety of discussions. I know this comes up a lot. There are a lot of partnerships that go into school-based health centers, especially if you're like in a district where you have multiple sponsoring organizations of school-based health centers working there. I appreciate kind of the challenges of those overlaps, but yeah, we definitely want to make it work.
Thank you. Because I did understand you guys to say that there's a minimum of 10 school-based health clinics that should participate.
Yeah, so the state level organization needs to have 10 participants. So for example, if you're a state affiliate of SBHA, you are not the sponsoring organization typically of the school-based health centers around the state. You would be sort of leading this learning network at the state level and recruiting 10 school-based health centers within your state. And those may be the same sponsoring organization of school-based health centers. It might be a variety of sponsoring organizations.
Gotcha. Thank you.
And then I have another one in my chat directly, Sarah, that's it says, to clarify, the original cohort of SBHCs cannot be sub-awardees to receive new funding. And that is correct, because they are not state level organizations.
I think they're asking if they could be a sub-awardee of whoever's awarded from this.
Gotcha.
I think it would have to be a case by case basis. I think that's similar to what Sherry's asking, maybe. And
I guess I can. I can clarify. So I guess I am asking if a state affiliate is going to be applying and they're working with, are you saying 10 sponsoring school-based, are you talking about 10 school-based health center sites?
Yes.
Specifically. So those sites, I would assume you would not want to provide new funding to. You might provide funding to the sponsoring entity to replicate across different school-based health center sites, but you wouldn't want those same sites to receive funding. Or are you open to that as well?
I think we would prefer to open up that opportunity to sites that hadn't already received funding. But I guess it would depend on the state situation. I know each state is different in terms of like the number of school-based health center sites that are even operating. I think another thing just to note is that for school-based health centers that had already participated in our previous cohort, if the state that they were in had a state organization that was awarded this grant funding, we would certainly want them to be connected to the work, even if they weren't a sub-awardee, because of the experience and the knowledge that they can bring to the group of what they have worked on over the last year.
Okay, great. Thank you.
Sarah, there's a question in the Q&A from Rebecca. Hi, Rebecca. As a state affiliate, we don't have access to some of the data requested in the RFA, such as total number of youth served. We have access to 2-year-old state data that represents SBHCs who receive state funding. Also, services offered vary from SBHC to SBHC. How should we approach these questions?
Katie, you might have better expertise on that than I do.
Well, I think in general, we're hoping to get this information state to state. Different people have access to different information, and so we would love to see it. And then if you can't get it, just explain why, or give us the best the best data you can get. If it's 2 years old, great, just let us know it's 2 years old. I think give us the best guess you can. I think in terms of services offered, broad buckets are fine. I think we want to get a sense of what your SBHCs look like, but feel free to add any caveats to your responses as you're writing them. And there's another one in the chat.
Yeah, I think I see the one about how many awards are anticipated. So we are anticipating at least 2. There will definitely be 2 states that are awarded, and it would be $350,000 for each of those states.
And if you have additional questions, feel free to unmute or enter them in the Q&A or chat. Not seeing any more pop up, but we'll give it a couple more minutes just to see if people are typing something.
Oh, Harper, can you answer the question that just came in about word limits in the application?
Yeah, absolutely happy to. So that is part of the reason we chose to do this 2-step application process. One of the benefits of using like a Word or a Google document is that there is no character count limit. So as Katie mentioned, if you need to add caveats to some of the data that we ask about, feel free to do so. And we don't encourage you to write 5-page essays for each question, but we will allow you the space to include all the data and information that you would like to or that you need to explain any of the answers. And then as far as that form, the online form part, they're really short questions. So I don't believe that there should be an issue with character count. But if you do run into anything, feel free to email me, Katie or Sarah.
Thanks, Harper. Yes, as Harper said, we're interested in getting a great picture of your sites. We also do not need to read major novels, so feel free to be concise. As long as we get the information, it does not need to be overly lengthy. Harper, do you mind going to our the slide with our contact info? Awesome. So if you think of questions after this call, you're welcome to reach out to us. You see both my and Sarah's contact info there, and then certainly we can connect you to Harper, the guru behind all of our tech support and
that's very generous, Katie.
application form. Awesome. we'll stay on a bit longer to see if there are any further questions, but again, if you think of something later, please reach out. Oh, perfect. Thanks, Harper. Harper's info is in the chat. If you don't already follow our information for the School-Based Health Alliance, there's all the things you need here on this slide to subscribe to our digest or follow us on social media. And the recording and slides will be available after the call. We'll be sure to make those available.